Welcome back to CNA's Q&A every Wednesday from 5 to 6 p.m. with Mel and myself, Lance. Let's discuss the challenges of preparing for the PSLE for both students as well as their parents during the COVID-19 pandemic. COVID-19 has caused nearly 2 years of disruptions to their learning on top of the usual stress loads concerning PSLE, which is viewed by many parents as a high-stakes event.
Even though the PSLE exams are less than a day away, it's still not too late to help both student and parent deal with stress and anxiety. There are tools to help you cope. So for this section of the Q&A, we have Dr. Petrina Wong, consultant pediatrician from SOG Clinic for Children, and Dr. Shawn Ee, clinical psychologist and psychoanalytic psychotherapist at the Psychology Practice. You can call, WhatsApp, or Facebook message us if you need advice. You know the numbers. Let's first talk about, to the both doctors, in addition to the children studying hard at home, some parents have not been taking them out often because daily infections are increasing, as we know, and these children aren't vaccinated yet. So what would you advise these parents do to keep them physically active yet safe? Dr. Ee, let's start with you.
This is it's a good question. I think currently a lot of parents might be pretty stressed out because of the pandemic. So I think oftentimes when we think about what we can get our children involved with, perhaps it starts as simple as reducing the kind of stress they might have by occupying them with other non-screen time related activities, a bit more social activities within the family, since the resources are at home already to start with. Yeah.
And what about you, Dr. Wong? What would you advise?
Yeah, I think it's very difficult times that we are in now. So you want to sort of balance the benefits as well as the risk. I think it's not impossible to stay physically active during this time still. So actually parents can still involve their children in like family activities, and this can be simple things like stretching, jumping, some exercises that you can do with in the mornings before they start their HBL, as well as towards like maybe afternoon whenever they're taking a break from work. I think it's good to have some like gym balls at home, doing some stretches. You don't need a big space, but yet you can still have them playing ball, like kicking the ball simply around the space at home, or even some open spaces where you're away from crowds. I think this is good during this period.
Dr. Wong, let's come back to you again.
Yes.
We know it's important to stay physically active and also to stay mentally alert. It's very important that they sleep well too. But parents also like to give their kids supplements. You hear about kids getting fed ginkgo nuts. Before a major exam, you also take out your brand's essence of chicken to give them some tonic to give them an extra boost, or maybe omega-3 pills. Are these still things that you should go to supplement their diet to keep them mentally and physically alert, or is this just a myth that we need to discard right now?
Okay, so that's an interesting question. So, yes, so I think there are certain foods that a lot of parents reach to, especially during exam periods. I think what's important is basically all children should get a regular, well-balanced diet, and this should involve less processed foods and lots of natural, wholesome foods. Now, these foods that I wouldn't say they're totally myths. I think there's some truth in that these foods are sort of high in antioxidants, and these are ingredients that we do want to include in a healthy child's diet. So there are sort of foods that are higher in antioxidants, higher in certain nutrients that we're looking to whenever we need children to sort of study better. And basically these are like brain foods. So antioxidants, I think, are found commonly, and in essence of chicken, I think it's highly sort of rich in antioxidants. So is ginkgo nuts. However, there are also other foods that are rich in them. For example, like natural berries, nuts, protein diet. So, for example, like fish, lean meat. I think these are foods that would be important in a regular diet for a healthy child. So you do not want to just start them just before exams or during exams. You actually want these to be taken regularly during regular meals.
And they must hydrate themselves very well as well, yeah?
Yes, so certainly fruits and vegetables and lots of fluids, that's certainly important. So you want to stay away from sugary drinks that do not give any nutrients. Versus like fruit juices versus fruit, you want the child to be eating the fruit. I think that's always a better option. And lots of water for hydration is certainly important.
But treating them for bubble tea after a tough exam is all right, yeah? Not just after
every
exam.
Occasional, yes, of course. So the occasional treat is always allowed, but these, because they contain high sugar, you don't want to have it on a regular basis. So it shouldn't be the reach to drink for hydration, because certainly that's not going to do them any good.
Was that your reward, Mel?
Well, bubble tea wasn't around but at the time, but I had a Coke, I think. Okay. Dr. E, let's talk about some children having added stress. Lance and I talked about this just now because they're under quarantine order, and they must stick to a strict set of rules in order to sit for that paper. So what can be done if the child, can't sleep at night before a big exam because of these extra worries, and even if they don't have these extra worries, right, because they're just worrying too much?
So I think in terms of this, we want to think of anxiety as a general way of trying to alert ourselves to what might be paid attention to. So if you're thinking about most anxiety, this might start to think that it could be a combination of both parents' anxieties as well as children's anxieties. So usually children get very worried because there might be a whole context of which might be left out because we're just looking at their current behaviours or their behaviour, what kind of struggles they might have. So we want to think of the context a bit in terms of the stressful environment of which they need to perform. Teachers, parents, and students all together, everyone's pushing their children to do better. Children in general want to seek approval from their parents, and they don't want to fail or disappoint their parents as well. So sometimes as a combination of these factors tends to keep children staying up, being bothered by their thoughts at night. So what I would suggest, what would quite be useful, is that nowadays we could start by assisting them to learn to breathe, to relax as well, as a way to re-engage their whole bodies and their mind as well. So there has been a lot of research that mindfulness and meditation can actually help children at that age too. You can do them with your children as well, such that it becomes a family activity that is low cost, and you can do that at any time of the day as well. But before sleep, if let's say children can't fall asleep, I would say don't keep on trying. Get up, maybe do like a light activity, like gentle reading, telling a story. Once they feel a bit sleepy, rush them to bed, and then they can start.
Well, it could also be because they're so stressed out that the exam is tomorrow, they may just be feeling a bit anxious as well. So what other telltale signs should we look out for in case the child is feeling more of the stress levels and it's going up and up and up? Are there certain things that you can spot straight away and tell them to take it down a notch or two to just calm them down, to tell them that yes, the exams are on the way, but you need to just relax and take things one step at a time? So what are the telltale signs we should look out for?
So these telltale signs are a mix of both physical and psychological. So if we look at what's on the surface, we might observe our children getting affected in terms of their concentration, affected sleep. That's one thing we know already. Their appetite, either eating too much or too little. Procrastination, that's a huge one because procrastination has been linked to perfectionism as well. General irritability. One of the things right now is just introduced again would be the home-based learning stuff. If your children start to be quite reluctant to want to do any kind of home-based stuff, emotional outbursts, frequent tearfulness, and other physical manifestations like eczema, hives, and these things are quite common. So Yeah, one way in which, a couple of ways that parents can go about, we want to think in terms of giving your child the permission to time out a little bit, right? Because children operate in a sense of, I don't want to fail, I don't want to do poorly compared to my peers, or, just, in terms of between siblings, or my parents who get very upset and disappointed in me. Encouragement, lots and lots of encouragement can be quite useful. And encouraging your children to look at the bigger picture of the culmination of your education, what you've learned so far, instead of, the idea of dreading the exams. So you can actually give them kind of like a whole change in mindset towards what exams represent. It's not just about evaluation, but it's about coming together and being able to put what you know on paper.
We are speaking to Dr. Shawn Ee and Dr. Petrina Wong. Just some advice from these two doctors about what to watch out for if your child's going through maybe a bit of stress just before a major examination. We're going to go for a quick traffic update, and we'll come back with more on the Q&A.
Okay, time now on CNA938 is 5:49, and according to what I have here, you must look out for a vehicle broken down on the AYE towards MCE after Buona Vista exit. And an obstacle you got to look out for, KPE towards TPE before Hallows Link exit, avoid lane 5. And you must also look for a breakdown vehicle on the SLE towards CTE before Mandai Avenue exit.
If you run a small business that you're looking to grow, could Cloud Solutions be the answer? How can they help manage workflows and digitally transform your business? One business leader shares his experiences on Friday, 1st October at 10:40 a.m. and 1:40 p.m. on CNA 938.
MoneyMind in partnership with Xero. Try Xero free for 30 days by visiting xero.com. Terms apply.
MoneyMind, weekdays 10 to 2 on CNA 938.
The one-stop online health event of the year is back. Join us on 9th October at Body and Soul Fair for a holistic day with professionals and celebrities. Don't miss the healthcare seminars, fitness classes, healthy cooking classes, exclusive deals on healthcare products, and more. You can also stand to win cash prizes. Register at bodyandsoul.sg now to access the webinars for free. First 2,000 registrants will also receive Lazada vouchers. Terms and conditions apply.
Welcome back to the Q&A every Wednesday on CNA 938 from 5 to 6. Dr. Wong, let's bring you back to the conversation because screen time was mentioned just now. Now, many children enjoy playing video games on their phone or the family's desktop computer, their laptop. But what's an acceptable time period for them to de-stress and play these games in between and during exam days?
Okay, so I think recently, there's been quite a bit of focus on screen times for children, and that affects sleep time. So the association is basically you wouldn't want too much screen time for a young child. And for all children up to adolescents, you don't want screen time too near to bedtime. The reason is because screen time can affect their sleep quality, and this is certainly not something that you want, especially during a stressful exam period. So I think if they're doing a little bit of screen time to de-stress, play a bit of game like when they get home from school, I think parents should control the duration. So I think if you're talking about average school day where you need to fit in homework or a bit of studying for exams, meals, as well as then an early bedtime, then I would say on an average school day, we can probably say that an acceptable time period may be something like half an hour or less. Certainly not something like goes beyond 1 to 2 hours, because then it may sort of eat into other time periods that are meant for sleep. Before bed, I usually tell parents to avoid screen time for children at least about an hour before bedtime. This is because the blue light exposure does create more problems for children to fall asleep at bedtime, and it also affects night waking, so meaning that they may have more restless sleep than they should be getting.
Dr. Wong, let's continue on with something that has happened because of COVID-19, and some parents have blamed home-based learning or HBL for their children's poor performance. As in, one child treated HBL as a holiday at home because they didn't have to go to school, so they were enjoying the time, just not being as attentive as they would in class. Some children also procrastinated. We heard Dr. E talking about this as well. Maybe they're perfectionists, who knows? But some of them may want to procrastinate and say, I can do it tomorrow, and then they cram for the exams at the very last minute. Should a daily timetable be created so that they can prioritize and learn and study better?
Yes, so I think HBL has certainly given new brought a whole new thing into our regular school system. I think most of us never had HBL as we were growing up, and I think the children during this period have been exposed to new things like HBL, and parents have been working from home. So there's certainly a lot of new things during this COVID period that we have to adapt to. Now, a timetable is good for kids because you certainly wouldn't want your child to be cramming for the exams, because you want to sort of do a daily regular revision, and that certainly always works better than last minute cramming for the exams tomorrow. Now, children thrive on routines. So when we talk about routines, we're talking about like a regular daily routine on a school day and a non-school day. And certainly I think HBL blurs that division between school days and non-school days because they're at home all the time. So a daily timetable would be particularly important because then you can give a sufficient time for meals, sufficient time for a break in between studying, and get some time off screen time, which is particularly important in children. So yes, a daily timetable would be a good thing to have, and also just to factor in adequate sleep depending on the age of your child.
Dr. E, we know of parents who take a year off work or take no pay leave to concentrate fully on their PSLE kids. So, they're stressed too. But what are the helpful or unhelpful things they might say during these times spent with their children?
I think in general, if we think about parents on leave, just so that they can watch over their kids as well, prepare them. I think one thing that gets in the way often is that parents' own work ethic gets in the way, of children needing to be kinder with themselves. And anyway, because this would be a developmental age of emotional regulation anyway, among crossing between the primary school age to teen and secondary school, high school age. So parents would need to help the children with that, not act against it. And what I mean by that would actually be to ask their children what they need, instead of telling children what to do all the time. Because children are nowadays a lot more independent. They would like the parents to see them being that way too. And it goes hand in hand. If my parents can tell me, I put my trust in you to be able to do this, we want to keep encouraging them, even if they slip off sometimes. Okay, so oftentimes parents, we find, tend to take over, and they might just load up on the tuition, cut down on children's rest time as well. All these rigid and amended routines, and as Dr. Wong had pointed early on, I totally concur that when these routines are amended and the structure is no longer there, what tends to happen for children is that we really mess up what they expect and to anticipate what will be in the course of the day. So this can really take away the periods of transition that's quite important for children to refocus. And these periods will be like traveling from home to school, from home to the playground, back to to their computer, to wherever that they need to be.
Now, you mentioned tuition just briefly. What are your thoughts on tuition and enrichment classes? We know that parents can spend a lot of money, sometimes up to thousands of dollars a month, to get these kids up to speed when it comes to catching up with the lessons. What do you think of these targeted approaches to help ease studying anxiety?
I think tuition can be both, it's a double-edged sword often, because on one hand, we want to try to support our children the best way we can, and a lot of parents, they don't have time to provide their hands-on tuition themselves, and sometimes they feel like it's in over their head. I think at the same time, tuition, when used at these last moments, tend to pile on the pressure instead of being able to, be there as a space such that if students have any questions, then they can approach the teacher or the tutor. So my view about tuition is that it can supplement the learning if it's regularly done and it's not as a ditch effort to sort of save the day.
Okay, very quickly, Dr. Wong, would you like to comment on that too?
Yeah, so I absolutely agree, Dr. Ee, that I think tuition's not for every kid. So I think some children do better with some additional help in certain subjects where they may be weaker and they may sort of need some extra time to sort of work on certain aspects. But however, we have to bear in mind, or rather parents have to sort of bear in mind that I think additional time at class and doing last minute cramming may be to the child's disadvantage, especially if it's going to add on to the stress and the pressure just before exams when you actually want to optimize their performance.
Dr. Petrina Wong, consultant pediatrician from SOG Clinic for Children, and Dr. Shawn Ee, clinical psychologist at the Psychology Practice. This has been the Q&A. You can find this in previous editions of the program on melisten.sg. Join us again next Wednesday at 5 o'clock with more questions and answers with the experts on CNA938.